Hello, everyone. I'm Sheldon Baker, and welcome to another episode of Healthy Bytes. And my guest today is Dr. Javier Tamargo. He is a registered dietitian, nutritionist with a PhD in dietetics and nutrition from Florida International University. He is also a postdoctoral researcher from the Pain Research and Intervention Center of Excellence at the University of Florida. His areas of expertise include healthy aging, chronic pain, cardiometabolic disease, cognitive aging and decline, clinical nutrition, metabolic syndrome, food security, and multimorbidity and nutrition-related health disparities. His research focuses on the role of nutrition and nutrition-based interventions in pain management and the preservation of cognitive and physical function among older adults, with the goal of promoting health, longevity, and independence. Dr. Tamargo, welcome to Healthy Bytes.
Thank you. Thank you for having me.
So let's start off by you telling me about some of the work that you have done regarding healthy aging and chronic pain.
Yeah, so my background is, as you mentioned, as a dietitian, and even though chronic pain is one of the leading health problems in the world, is the leading cause of disability worldwide, it particularly affects older adults more than anybody. Very little relatively has been done to understand the role of nutrition in pain. And among the lifestyle factors that are so important to our health, nutrition is central to absolutely everything. And that's why my research involves so many areas of health, because at the end of the day, nutrition is at the core of everything. So currently, I am focusing on trying to understand the role of nutrition in the neurobiological mechanisms of pain, because pain at the end of the day is our feeling based on the processes that the brain is creating for us to feel pain. So I like to say pain is in the brain. So I'm trying to understand how nutrition plays a role there and what we can do to mitigate it. And we recently completed a small trial looking at krill oil supplementation for older adults. And I can explain what krill oil is. Yeah.
Within your work and your research, how have you found the elderly and elderly patients with chronic pain currently managing their condition, and in particular, what types of painkillers are they using?
Yeah, so that's a great question, because with older adults, what we see is that they've been living with pain for a long time already. By the time that we see them, for example, in our study, the average amount of time that people had been experiencing their pain was 10 years. So at this point, they've tried almost everything. And the primary ways that they try to manage it is, one, they really learn to live with it. And they use self-management strategies like heat and cold pads, movement, and then they do use medications, mostly for those that have moderate or mild levels of pain. They tend to go for the ibuprofens and NSAIDs like naproxen and things like that, acetaminophen, the non-opioid medicines. Some do use the opioid medicines, but in general, they are more wary of them, and they try to avoid them. Those with more severe disease do use opioids more regularly, but actually the guidelines now by the CDC and other agencies is to use non-opioid therapies as the first line approach. And that's what they want. And that's why they were interested in nutrition and in things that they can do lifestyle-wise to mitigate pain.
So the recent study that you were involved in was a krill oil study, and those findings suggested the potential role of non-drug approaches for chronic pain management in older adults. Is that correct?
Yeah. The findings are preliminary, I will say, because it's a small study and it needs to be corroborated with longer and larger samples and longer duration. But the findings are very encouraging. So it's krill oil is a source of omega-3 fatty acids, which are very popular. Most people are familiar with fish oil. And so the thing is that with supplementation, it's hard to know what you're getting, one. And two, the literature on fish oil is kind of inconsistent. And for pain, not particularly promising. Krill oil offers some benefits over fish oil that gave promise to it. One is that the EPA and DHA, which are the fatty acids that mostly we're interested in, they show higher bioavailability, meaning that our bodies are better at absorbing them and using them. But additionally, krill oil is a natural source of two nutrients that are particularly important. One is astaxanthin, which is a very strong antioxidant, which we wouldn't get in our diet otherwise, not much of it. And choline, which is an essential nutrient, it's a mineral, but the USDA actually considers it a nutrient of concern for older adults due to low intakes and poor consumption of it. So krill oil overall has some benefits that.
So I guess based on what you just said, that's why krill oil works so well in this study.
In part is because, so we would have to explore more about exactly what is happening at the cellular level, and we are exploring those mechanisms. But what I will say is that the thing that was most impressive is how acceptable it was for older adults. One thing that is difficult with any medication and any sort of intervention is adherence. And older adults are already taking a lot of medications. They're doing a lot of things. And these capsules are, if anyone's familiar with fish oil, they tend to be large size capsules. And in our study, we were providing 4 capsules and they had no problem with consuming them. So we saw very high adherence and high levels of acceptability, meaning that the participants were satisfied in actually consume the supplement as intended. And I would say that that's the biggest thing. Because without, like, it could work perfectly, but if people don't consume it, then it doesn't work, right?
I have reviewed a little bit of the study. What does the increase from 4.3% to a 7.4% omega-3 index suggest about the relationship between omega-3 levels and chronic pain?
That's a great question. And it's one of the most important findings that we have. So the omega-3 index, for those that don't know, it's really the best way for us to know your status of omega-3s in the body. And omega-3s are essential fatty acids, meaning that we need to get them through the diet and we need them to survive and to be in optimal health. However, they are very scarce in the American diet. So the omega-3 index is specifically the proportion of EPA and DHA in red blood cells, out of the fatty acids in red blood cells. And what a vast amount of evidence now shows is that levels of 4% or lower are associated with a larger risk for all-cause mortality, cardiovascular disease, dementia, and things like that, versus 8% or higher indicates protective effects against all those things. So in our sample, we started just above 4%, which matches the general population very well. and it increased to 7.2 or something like that, or 7.4, which is very close to that 8% that is ideal. And that would benefit not just for pain outcomes, but for overall health. So that is a very clinically meaningful improvement.
Confirm, what was the length of the study?
3 months, 12 weeks.
12 weeks, okay, all right.
Yeah.
Good.
We would definitely want to follow up for much longer duration and see how, because the body first adjusts to the increase in of omega-3s in circulation, right? And then you start getting the benefits of it. So what we saw in our study is that within 6 weeks, the levels started to achieve a status where they leveled out. They do improve at a lower rate after that, but the benefits are reaped after that has happened. So we are very encouraged by the findings and look forward to seeing what happens over longer periods.
Do you think the effects would become stronger if the study was for a longer period of time?
So for some things, they might just stay the same. For some things, they might actually improve. So for instance, some of the things that we saw improvements were in pain intensity, which is what most people think as pain, is how intense it is. And we also saw reductions in the number of pain sites that people reported, which is particularly interesting. What we didn't see benefits in the 3 months is in what we call pain interference, or how it leads to how pain restricts motion and mobility and activities of daily living and things like that. And I do suspect that those are things that we could see benefits over a longer period of time once the pain has really reduced and you start accommodating your life around the fact that you have less pain now.
Was there a specific type or kind of krill oil that you used?
Yeah, we use Superba Boost by Acre Biomarine. It'll be available in the publication. Yeah.
So what does the future hold? Do you plan on doing more krill studies?
Absolutely. So one is to use these findings to launch a larger study with more participants and longer duration to really observe more realistically what the benefits are over a longer period of time. And as I said, I do want to explore, it's good to know that it's actually relieving pain, but we also want to understand exactly how it's doing so. So looking at some of the cellular markers that might be improved.
Dr. Tamargo, I appreciate you joining me on Healthy Bytes and sharing this information about the krill oil study.
Thank you. Thank you for having me.
And thanks to all of you for watching Healthy Bytes.